And welcome to my video channel. My name is Dmitry Hristov and I'm a physiotherapist who works and lives in Plovdiv, Bulgaria. I treat mostly people with stroke, MS, traumatic brain injury, so you could say that my scope of practice is mostly neurological. In today's video I want to talk more about stroke recovery and can we predict if someone who's recovering after stroke will have severe functional limitations, or maybe he or she will have a full recovery. So before we continue, I want to make a short disclaimer. I'm not a medical doctor, so the advices and the information you hear here in this video is not medical advice. If you're recovering after stroke, or maybe you have a family member or a close friend who's recovering after stroke, please listen to your medical doctor and the physiotherapist or any occupational therapist who are working with you, because they know you better, they know your condition and your limitations. Now let's continue with the video. The stroke is a condition of the blood vessels which affects the blood flow, but it has severe neurological complications. Well, sometimes they're not so severe, it depends on the type of the stroke, the place where the stroke is happening, and the quickness of the reaction of the medical professionals and the family members. But in the textbooks there are different kinds of classifications, but we know two types of stroke. The first one is the most severe one. This type is called the hemorrhagic stroke. In this type of stroke we have blood going inside the brain tissue. So the blood is leaking out of the artery and is going inside the brain tissue. The blood itself is very toxic to the neurons, so this leads to death of the neurons which have contact with the blood. The blood also increases the intracranial pressure, which presses more blood vessels which cannot do their function, and their function is to deliver oxygen-rich blood to the blood tissue. So this is a very severe condition. A lot of the patients are dying from it. They need to stay for longer time in the intensive care unit, and usually the functional limitations they have are bigger. So if you have this type of stroke, the prognosis usually is bad. Of course, every case is different. I'm not saying that you will not be able to live a good life. It depends of the therapy and your functional capabilities. Fortunately for us, this type of stroke is not happening so often. The second type of stroke, which is the more common one, is the ischemic stroke. The reasons for the ischemia could be different. Usually it's a blood clot which is blocking an artery and is partially or fully stopping the blood flow. Again, this type of stroke is more common, and the functional recovery after stroke depends on the place where the stroke is happening, how fast an adequate treatment is received. It's individual for the different patient. But usually the ischemic stroke is a stroke which allows faster recovery, shorter stay in an intensive care unit, and you can start working with the physiotherapist early on, usually 24 hours to 48 hours after the incident. So the ischemic stroke usually leads to better prognosis. But again, different strokes, the different places where the stroke happens leads to different functional outcomes. So now we know that the different places means different results. Which places? We know that if the stroke is happening deeper and is affecting the older parts of the brain, the results, the functional outcomes are not so favorable. That means that well, you need to, well, you can see some pictures online, but you can imagine the brain like a structure with different levels. The more primitive structures are deeper, and newer, more complex structures, which are giving us the more complicated functions, are above in the cerebral cortex. If the stroke is happening to the cerebral cortex, usually, if the treatment is adequate, the functional outcomes are better. But if the stroke is deeper into the brainstem, the results are not so good. Why is that? Because the brainstem, the deeper parts of the brain, is the place where the axons of the neurons which are in the cerebral cortex are going through. So if the space, it's not so big, but the axons are the space is not so big, and the ischemia or the hemorrhage could damage more axons. The more axons are damaged, that means that the more neurons will not be able to send signals down to the spinal cord and to the muscles. So the place is very important. Of course, there are different classifications according to that. I will not describe them. A medical doctor, a neurologist, will be better suited to do that. The time of the treatment is very important. When is happening? If the reaction of the family members or friends is fast enough, and the patient is transported to a neurological department or intensive care unit, and this patient receives good treatment, usually the functional outcomes are better. So you have to check that there is an acronym which is called FAST. It's all over the internet, but fast reaction is crucial. You need to act fast. It's better to medically treat the stroke than rehabilitate them, because treatments means that more brain tissue will survive. Rehabilitation means that you have to live with what you have, and to live better with what you have. It's better to live with more brain than with less, trust me. The stroke is creating the framework in which we work. If the stroke is very severe, we can achieve less. It doesn't matter how much your physiotherapist knows, or he or she, or how capable is he or she. The stroke sets the framework. We work in this framework. And by doing a lot of work, we are hoping that the brain tissue which survived will take some of the damaged functions. But believe me, better to act fast, to save more brain tissue, more neurons. This will lead to better functional recovery. So the stroke has happened, and you're in the intensive care unit. Can we predict if you're going to have a better functional recovery? Yes, according to the research, we can. If there is some movement of the fingers 72 hours after the incident, that means that there is a good chance that the hand and the arm will recover. Maybe not fully, but the hand and the arm will be functional. So this is a very good predictor for functional recovery, movement of the fingers. That means that the damage is less, or maybe the shock itself is less, so you can do more in the early stages. The second good test for that is the trunk stability. If the patient can sit, let's say in the first week, if you can put the patient in a sitting position and he or she is stable, that means that there is a good chance for the patient to recover fully or with not so severe limitations. So when I'm treating someone with stroke, these are two of the questions I usually ask when it's not so obvious. Did you move your fingers early on, or can you sit? Can you stay into the sitting position without any support? When I'm approaching someone who had stroke recently. So by knowing these two things, we could say that yes, this person will recover and he will recover, and the prognosis for recovery is a good one. So these are the two things I wanted to tell in this video, these two tests. If you are happy with what you hear and you want me to make more video in English, please subscribe to this video channel and write your comments in the comment section. I will be happy to answer them. Thank you for your attention.